Hi friends, good evening. Once again, welcome back to my channel Mugambika Nursing. Friends, in the previous two videos, we discussed fundamentals of nursing questions. Go through that questions. Today, in this video, we can see important and previous year questions from previous question paper. Let's see the questions. First question, zinc deficiency can cause which of the following? Options. Option A, myopathy. Option B, goiter. Option C, multiple sclerosis. Option D, infertility. Our question is, the deficiency of zinc causes which one of the following disease? The deficiency of zinc causes hypogonadism, infertility, dermatitis, diarrhea, poor wound healing, growth retardation, alopecia and immunodeficiency. So in our option, infertility is there. So that will come correct answer. Deficiency of zinc cause infertility. Option D is the correct answer. And the next question is 100-day cough is. Options. Option A, pertussis. Option B, mumps. Option C, measles. Option D, diphtheria. 100-day cough or whooping cough is pertussis. Option A is the correct answer. Pertussis is caused by Bordetella pertussis. Its incubation period is 1 to 2 weeks. Move on to the next question. Simple squamous epithelial cells are primarily found in. Options. Option A, ureter. Option B, intestinal lining. Option C, alveoli of the lungs. Option D, urinary bladder. Simple squamous epithelial cells are mainly or firstly found in alveoli of the lungs. Option C is the correct answer. And also it is present in lining of the blood vessels. Move on to the next question. Which vaccine is contraindicated in pregnancy? Options. Option A, rubella. Option B, diphtheria. Option C, tetanus. Option D, hepatitis. All live vaccines except yellow fever vaccine is contraindicated in pregnancy. So here hepatitis, tetanus, diphtheria, all are live vaccines. So the correct answer is rubella. Rubella is contraindicated in pregnancy. And the next question is, which of the following condition can lead to an increase plasma osmolarity? Options. Option A, anemia. Option B, hyperventilation. Option C, dehydration. Option D, hypoventilation. Our question is, which condition can cause increased plasma osmolarity? When our body is not getting adequate amount of water or decreased water content in the body causes increased plasma osmolarity. So that is dehydration. Option C is the correct answer. Move on to the next question. Damage to which cranial nerve can lead to ptosis? Ptosis means drooping of eyelid. And diplopia. Diplopia means double vision. Options. Option A, cranial nerve 3. Option B, cranial nerve 5. Option C, cranial nerve 7. And option D, cranial nerve 12. Our question is, which cranial nerve injury causes ptosis and diplopia? It is cranial nerve 3. Option A is the correct answer. Cranial nerve 3 is oculomotor nerve. And the next question is, which cranial nerve is responsible for controlling the muscles of mastication or chewing? Options. Option A, cranial nerve first. Option B, cranial nerve 5. Option C, cranial nerve 7. Option D, cranial nerve 10. The cranial nerve which is responsible for mastication or chewing is trigeminal nerve. It is cranial nerve 5. Okay. Option B is the correct answer. And the next question is, which blood type is considered the universal donor? Options. Option A, type A. Option B, type B. Option C, type AB. Option D, type O. Here the question is, which blood type? It is not mentioned blood group. Okay. The universal donor is type O or O negative is known as universal donor. AB positive is universal recipient. And the next question is, dysthymia is. Options. Option A, chronic mild depression. Option B, bipolar disorder. Option C, chronic severe depression. Option D, personality disorder. Here the question is, what is the meaning of the word dysthymia? Dysthymia means it is chronic mild depression. Option A is the correct answer. The Greek word dysthymia means bad state of mind or ill humor. It is seen in case of depression. And the next question is selective medium for Shigella is options. Option A chocolate agar, option B twin agar, option C nutrient agar, option D none of this. And the correct answer is it is option B hectoin agar. Move on to the next question. The following reflex appears at options. Option A 6 weeks, option B 18th weeks, option C 16th week, option D 22 weeks. Here our question is at which week of gestation the swallowing reflex appears. Okay, it is at about 16th weeks of gestation. So option C is the correct answer. On to the next question. The inner triangle in the symbol of under 5 clinic denotes options. Option A family planning, option B preventive care, option C health education, option D growth monitoring. In under 5 clinics, the inner triangle denotes what? Okay, it denote family planning. See inside the inner triangle which denote family planning. So the correct answer is option A family planning. And the next question is immunization is options. Option A primary prevention, option B primordial prevention, option C secondary prevention, option D tertiary prevention. Immunization is an example of primary prevention. Option A is the correct answer. And the next question is the defense mechanism in neurosis is options. Option A regression, option B distortion, option C repression, option D conversion. Defense mechanism in neurosis is repression. Option C is the correct answer. And the first option regression which is seen in case of neurosis. And the next question is the test used to identify frozen vaccine is options. Option A shake test, option B Schick test, option C Hubble test, option D none of this. The test which is used to identify frozen or freezed vaccine is shake test. Option A is the correct answer. Move on to the next question. Vitamin required for collagen synthesis is options. Option A vitamin A, option B thiamine, option C vitamin C, option D folic acid. Here the question is which vitamin is necessary for the synthesis of collagen? It is vitamin C. Correct answer is option B. And the next question is sickle cell anemia is options. Option A autosomal dominant, option B autosomal recessive, option C X-linked dominant, option D X-linked recessive. Sickle cell anemia is a type of autosomal recessive disorder. Here the correct answer is option B. And the next question is very easy question, direct question. What is the average lifespan of red blood cells? Options. Option A 250 days, option B 50 days, option C 180 days, option D 120 days. The average lifespan of RBC is 120 days. Option D is the correct answer. And the next question is pepsinogen in the stomach is secreted by options. Option A chief cells, option B goblet cells, option C G cells, option D parietal cells. Pepsinogen is secreted by chief cells. Option A is the correct answer. Move on to the next question. Air bongogram in X-ray is seen in case of options. Option A sepsis, option B respiratory distress syndrome, option C tuberculosis, option D bronchial asthma. Air bronchogram or air-filled cavities are seen in case of respiratory distress syndrome. Option B is the correct answer. Friends, today we discussed some of the important and previous year questions. Surely these questions will be helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle and subscribe my channel.